Hello, and welcome to episode 3 of the Pet Behaviour Chat. So today we're going to be chatting all about what a veterinary behaviour consultation actually looks like. And I'm going to walk you through the 7 steps that I always include in my veterinary behaviour consultations. And I'm also going to talk a little bit about the differences and the similarities of a veterinary behaviour consultation versus a regular veterinary consultation, if you like. So that's where I'll start. So the differences are obviously, the main one is the length of time. So our veterinary behavior consultations take usually around 90 minutes, sometimes even up to 2 hours, depending on the complexity of the case. And that's because there is quite a lot to delve into, quite a lot to talk about. And we also want to have quite a good amount of time if the consultation is being held in person to be able to observe the animal. And sometimes with behavior, that takes a little bit of time. So we all know, for example, when we take our pets to a regular veterinary consultation, which is maybe 20 minutes long, oftentimes the pets don't exhibit behaviors in that time because they're either very scared or they're frozen or they're shut down. So that length of consultation in the veterinary behavior consultation actually allows us to perhaps see some of the more standard behaviors start to emerge and gives us a much better overview. It also allows us to assess things like pain. We can observe a little bit more how the pet is moving around the room, how they're sitting down, lying down. And again, it just takes a little bit more time to be able to observe those small nuances. So that's the biggest difference is the length of time that the behavior consultations take. In terms of similarities, there are also a few. So I always say that we approach a veterinary behavior consultation very much like we would a normal veterinary consultation. So we go through the same sort of steps. We look at history. We do an examination. So that could be a physical exam if the pet allows it, or our sort of examination is the visual observation, the reading of body language signals. And then again, we come up with a list of differential diagnoses. And then finally, we have our list of diagnoses, and then we move on to a treatment plan. So there are very similar approaches between behavior consultations and, let's say, veterinary consultations for other presentations. The length of time, I think, is probably the biggest point of difference. Okay, so what are the steps? What are the processes that we go through? What could you expect if you came to see myself or another veterinary behaviorist for a veterinary behavior consultation? So the first thing is before the consultation, you're going to receive probably quite a lengthy questionnaire to fill in. So my questionnaire is somewhere between 10 and 15 pages, and it really sort of dives into the behavioral history. So I want to know about where did you get your pet from? What were their previous experiences before they came to you? What are the most significant events? Why are you presenting this pet for a behavior consultation? What have been the most recent events? When did it start? What's the progression been? And I ask a lot of questions also about physical health. What types of medications is your pet on? What are your expectations? What are you hoping to achieve? So the questionnaire is really a big piece of information that I go through in detail before I even see your pet, so that when I get to meet you and your pet, I have a pretty good understanding of what your main concerns are, what you're struggling with, and what the things are that we really need to dive into. I often also ask for videos to be supplied beforehand. So I really want to see the pet in its natural environment. I do not want owners to create any kinds of situations where the pet might actually show that unwanted behavior. So for example, if the pet's coming to me for aggressive behaviors, I don't want videos that have been specifically created just so the pet becomes aggressive. So that's not what we want. But we do want to know, what does the home setup look like? What does the dog do sort of on a daily basis? What's the 24-hour day look like? Where do they sleep? What kind of safety measures might or have already been put into place? And then obviously, if there have been videos caught previously of the unwanted behaviors, then to share those as well. So the videos, again, can give me a really good insight into things. And I also want to, at this point, look at the pet moving. Are there any signs of abnormal gait? Do they look stiff? Are they perhaps maybe sore on one limb. So all those types of things we want to look at in the videos. And then very often I'll also ask for a drawing of or a floor plan of the home layout. This is particularly important for cat consultations because I want to know where are all the resources positioned within the home. So where are the litter trays? Where are the feeding stations? Where are their cat flaps potentially? So all those types of things I really want to know, because it's possible that we're going to suggest some changes to the environment, or that things are positioned in a certain way that are perhaps contributing to the unwanted behaviors, or that are not providing an optimal environment. So that's the questionnaire, the videos, and the layouts, the room layouts. Next is we chat through a really detailed behavioral history. So I'll usually use the questionnaire to base that on, but there might be things that I just want to delve into a little bit deeper, or there might be some situations that I would love the client to explain in their own words, just to give me a little bit more nuance or color to some of the events that they've described. I want to know about things like frequency, duration, intensity, the recovery from the behavior. All those things are really, really important. So we go into real kind of detail about the behavioral history, and I just get a lot more kind of, like I say, nuances around those certain situations. The next thing is I want to have a really detailed medical history. And if I can, if the animal allows it, I also want to do a physical examination. Now, the detailed medical history is really important because during the course of this residency, amongst the 400 cases that I've seen, I would say probably about 70 to 80% of patients have had some kind of contributor that has been a physical ailment or a physical disease. Now, that can be pain, that can be gastrointestinal issues, that can be skin problems. All of those things can contribute to behavioral health. And unless I know about those, and unless I can address those, we might not make such good progress in the behaviors that we want to change. So a physical examination, if I can, if the dog is very, very aggressive or very fearful and doesn't want to be handled or touched, then that's something I might do at a later stage. And I might perhaps recommend some pre-visit medications, or we might start trying to reduce the animal's arousal levels before I attempt a physical exam. But if the animal allows me to, I'll do a full physical exam, again, to try and understand if there are any physical medical contributors to the behavioral presentations. So that's my step 2. Step 3, no, that was step 3. So we've got questionnaires, behavioral history, detailed medical history. Step 4 is we're going to look at body language. So this is a really, really important piece. And this is especially good to do if the animal is in the room with you. So if I'm doing a hands-on behavior consultation or face-to-face behavior consultation, but we also talk about body language in our virtual consultations as well. So obviously our pets can't talk to us. So we need to try and understand from their body language, their facial expressions, potentially vocalizations, what their emotional state might be. So this is something that is part of the sort of initial process, is really looking at body language. And some of this can also be seen on the videos that are sent, and then educating clients about body language and what their pet is communicating in any given situation, and how they can perhaps in future pick up on the more subtle signs of body language communication, all those early indicators that their pet isn't feeling comfortable in a certain situation. And this is a huge piece of the puzzle when it comes to a successful outcome in behavior cases. So I really want to help clients understand their pets a little bit better and try and understand what they're communicating to them. And this is the moment where we often have aha moments or big sort of light bulbs going off, because all of a sudden pet parents can start to see actually their pet's behavior is due to an underlying emotional state. And we dig into that in quite a lot of detail. And this takes up quite a big portion of the behavior consultation. And again, it can be done face-to-face, or it can also be done via video consultation. So we've been really successful with both. But yeah, this is a big piece. And then with that comes the education around mental health, mental and emotional health in pets, that this is not something that only applies to people, but that we also have to take very seriously mental and emotional health in pets. And, that perhaps their pet's behavior problem is not something that can simply be trained away, but that we actually have to look at underlying motivational states. Perhaps the pet doesn't feel safe in certain situations, and that's why they're reacting. And yeah, this is a big piece of the puzzle. So we do a big portion around education and, how we sort of need to start thinking about that particular patient. And this is where it can sometimes get emotional as well for clients, because I think perhaps sometimes that understanding and that empathy starts coming in, that actually their pet is feeling a certain way and is not behaving because they're naughty or out of malice or spite or all those things that we sometimes hear, but actually that maybe their needs aren't being met, maybe they just don't feel safe, and they're acting because of how they feel. So a very, very important piece, and this is something that takes up the majority of that sort of 90-minute to 2-hour behavior consultation. At the end of that, I start to get a clearer picture of what my differential diagnosis list looks like, and what my diagnosis list looks like. Oftentimes with behavior cases, we have a number of different diagnoses. It's not just one. We could perhaps have an anxiety disorder, as well as fear of specific triggers, as well as perhaps pain. So it could be that we have a number of different diagnoses that start to kind of crystallize themselves out, and that starts to become clearer and clearer. And this is a really important part of the veterinary behavior consultation process, because as vets, we are in a position to diagnose problems, and it's our duty to diagnose things. And it's only when we have that diagnosis that we can actually build a treatment plan on that. I think so often we perhaps, if you don't have a diagnosis, we just start kind of doing, putting together a random treatment plan that perhaps isn't tailor-made or isn't suited to that individual's needs. Or we perhaps forget an important piece of that treatment plan, such as treating pain, for example. So that diagnosis list is really, really important. And again, it's a really good point to explain to clients, look, your pet is dealing with a number of different things. It's not just the barking. It's not just the urinating outside the litter box. We've got a number of different things going on here. And in order to change behavior and to have a successful outcome, we need to address all of those aspects. So that is number 5, my diagnosis. And then number 6 is a really, really important piece as well. So at this point, once we have the diagnosis, I often have a conversation about setting realistic expectations. And I'll often ask a question, something like, what would a successful outcome look like to you? And the pet parent will give me their idea of a successful outcome, and then we can discuss together whether we think that that's a realistic outcome or not. So, for example, a dog that is maybe very, very anxious and doesn't like strangers coming to the home, could a successful outcome look like he's suddenly super friendly and very happy to greet everybody that comes into the home? Probably not. But can we change things, and can we help that animal feel better about situations, less anxious, less fearful? Can we manage the situation? Can we perhaps use pheromones or supplements, or perhaps even behavior medications to help in those situations? And can we then together come up with a realistic expectation? So it's really important, I think, that pet parents understand what they can and cannot expect, and how we're going to start moving towards those goals. And, also a situation or an opportunity to talk about, if they do have unrealistic expectations, how they could perhaps change their mindset around things, and how that would still be, if not a successful, at least an acceptable outcome for them, to live happily together with that pet. In this moment also, we talk about timeframes, because behavior modification doesn't happen overnight. We can oftentimes affect a couple of quick wins. So we can make some initial differences to the environment or to the way that the pet is interacted with that can, vastly improve outcomes quite quickly. However, long-lasting change and the way that the animal feels about certain things might take a little bit longer. And we often talk about 3, 6, 9, 12 months, that sort of time frame. And again, it's just enabling the pet parent to understand what their journey, might look like and how they're going to kind of progress through that journey. So that's point number 6, is setting expectations, a really, really important piece. And sometimes, can be an emotional conversation, but oftentimes the thing that will make the difference between a successful and a non-successful outcome, I believe. And then finally, we co-design a treatment plan. So this is what the pet parent or the client walks away with at the end of a behavior consultation, is an initial treatment plan. Now, that treatment plan might change over time as behaviors change, as we see whether that pet is susceptible to behavior medications or other changes in the home, as things move forward, and also as clients learn more about their pet's behavior, about those body language pieces. That treatment plan can potentially change. So we come up with an initial treatment plan with the understanding that might change and that's fluid over time, but we'll definitely give a number of strategies of things that can be implemented and started immediately. So clients walk away really with an immediate action plan of things that they can do. And sometimes the thing to do is actually just to not do so much. So oftentimes, we might advise to perhaps stop very rigorous training, or, to stop aversive methods and to stop punishment. So sometimes it can be a case of not doing as much as doing, a lot of things. But oftentimes, we'll be implementing safety management plans and so on and so forth. So that's the treatment plan. And it's really important to me that I co-create that treatment plan together with my client, because there's absolutely no point in me coming up with the most amazing treatment plan, in my view, and then, the client saying there's absolutely no way I can implement that. Either it doesn't suit my physical environment, it doesn't suit the home I live in, or it doesn't suit my lifestyle, or I just physically can't, make enough time for certain things, or I'm not able to do X, Y, and Z, but instead I can do this. So we co-create a treatment plan, and we often, compromise on the way forward and how we're going to do things. And that, again, is very important to get that buy-in from clients, and to make sure that they're fully on board and that they can understand why we're doing certain things and that they're happy to implement those things. And sometimes, it's also down to a little bit of perhaps behavior change or mindset change or habit shifts in the client themselves. And we all know that takes time. Changing habits takes time, takes many weeks. So the first kind of treatment milestone for me is usually 6 to 8 weeks. So we'll be checking in with the clients for the first 2 weeks after the initial consultation. We'll be checking in them, every other day, just to see how they're managing, how they're getting on, if they have any questions about implementing things. And then the first big sort of treatment milestone will be after 6 to 8 weeks, at which point we reevaluate, we discuss what's working, what's not working, and then we set the treatment plan for the next 4, 6, 8 weeks, and so on. So that's what a behavior consultation looks like. That's what you can expect if you work with myself or a veterinary behaviorist. I hope that's kind of helped to a little bit lift the cloak, I think, of what lies beneath. Sometimes it can be difficult for clients to understand, what a behavior consultation entails. And, they might have had experiences with previous, perhaps behaviorists or trainers, where they were asked to do things that they didn't like a lot. So for us being really clear and transparent about, what you can expect, and not to have to feel nervous or worried about coming into a behavior consultation, that we're here to support you, support your pet, support your whole family as best as we can. That's our main goal. So if you do have a pet that's struggling with a behavioral problem, this is what you can expect. And please let us know if that's something, that you might be interested in, or if you have further questions, post them below this episode and let us know if there's anything else that we can answer for you, or if there's anything else that I didn't cover in today's episode. Okay, that's it for today. We'll see you in the next episode. Bye for now.